everyone. Welcome all of you in See and Perceive section. Today I will be talking about urine analysis. The topic is arranged under following subheadings: Introduction, Definition, Purposes, Articles Required, Reagents, Procedure, and Special Considerations and Suggested Readings. So let us begin with the introduction. Urine tests are very helpful for provision of information to assist in diagnosis and treatment of a variety of disease conditions. Urine analysis involves examining the appearance, odor, pH, specific gravity, and presence of sugar and albumin. Definition is: urine analysis is a process of analyzing urine scientifically to detect abnormalities. It is a diagnostic, physical, chemical, and microscopic examination of a urine specimen. Purposes are general evaluation of health, monitoring any abnormality in the urine, diagnosis of disease or disorders of the kidneys or urinary tract, diagnosis of other systemic diseases that affect kidney function, monitoring of patients with diabetes, and points to remember are: collect the urine specimen in a dry container and use a container with wide mouth. Articles required: a clean tray containing the following articles: a spirit lamp with matchbox, test tube holder, rag pieces, bowl with water, kidney tray, clean gloves, urine sample, chemical reagents, and urinometer. Reagents: Benedict solution for sugar testing, acetic acid solution 2% for albumin hot test, nitric acid solution for albumin cold test, sodium nitroprusside crystals for acetone test, ammonium sulfate crystals for acetone test, fresh concentrated ammonia solution for acetone test. Now coming to the procedure. Inspect for the following: color. Take a clean glass jar, pour urine in it, place it on a table against light and note the color. Normally, it is pale yellow or amber color. Inspect the appearance. Inspect for presence of sediments or suspended particles. Normal urine is clear and straw colored. Dark or amber color indicates infection. Inspect the odor. Freshly collected sample is odorless. Aromatic odor indicates breakdown of ammonia. Fourth, volume. Take a graduated jar and measure the urine. For accuracy, take the lower meniscus. Fifth is pH. Dip litmus paper in urine, keep aside for a minute to note the color changes. If blue litmus turns red, urine is acidic. If red litmus turns blue, urine is alkaline. If there is no color change, then urine is neutral. Sixth, checking specific gravity of urine. Definition: the specific gravity of urine is the measure of the solute concentration in urine by using a calibrated urinometer and is used to assess the ability of renal tubules to concentrate or dilute the glomerular filtrate. In adult humans, specific gravity value ranges from 1.010 to 1.040. The purposes are to measure the specific gravity of the urine, determine the level of concentration of urine. Coming to the steps of procedure. Checking specific gravity of urine. Pre-procedural steps. Explain the procedure to the patient. Provide container and instruct the patient to collect urine. Intra-procedural steps. Wear gloves. Fill 3/4 of the jar with urine. Gently place urinometer into the jar. Make sure that urinometer floats freely and does not touch bottom and the sides of the jar. When urinometer stops bobbing, read specific gravity directly from the scale marked on calibrated stem of urinometer. Read scale at lowest point of meniscus to ensure an accurate reading at eye level. Post-procedural steps. Discard urine and rinse jar and urinometer in running water. Replace articles after washing. Document the results in the appropriate record. 7th, test for albumin in urine. Hot test. Definition is: hot test is used to find out presence of albumin in urine. Purpose: to identify presence of albumin in urine. Steps of procedure: test for albumin in urine, hot test. Steps of procedure: pre-procedural steps. Explain the procedure to the patient. Provide container and instruct the patient to collect urine. Intra-procedural steps. Fill the test tube with 3/4 part of urine. Light the spirit lamp and boil the top 1/3 part of the urine. Observe the top heated column of the urine for a cloudy appearance. Clear urine indicates absence of albumin. If cloudy, add 5 drops of 2% acetic acid. If the urine becomes clear, it is due to phosphates. If not, heat the entire content to boiling and observe after 15 minutes. Post-procedural steps. Discard urine. Replace articles after washing. Rinse jar and urinometer in running water. Document the results in the appropriate record. Test for albumin in urine. Cold method. The definition is: cold test is used to find out presence of albumin in urine. Purposes: to identify presence of albumin in urine. Steps of procedure: test for albumin in urine, cold method. Pre-procedural steps: explain the procedure to the patient. Provide the container and instruct the patient to collect urine. Intra-procedural steps: take 2 cc of nitric acid into a clean, dry test tube. Pour a similar quantity of urine with a dropper gradually from the side of the test tube. Appearance of a white ring at the junction of the urine and acid shows the presence of albumin. Post-procedural steps: discard urine and used nitric acid solution. Replace articles after washing. Document the results in the appropriate record. Next, test for sugar in urine. The definition is: test for presence of sugar in urine specimen by using Benedict's solution. Purpose is to measure amount of glucose in urine. Steps of procedure: test for sugar in urine. Pre-procedural steps: explain the procedure to the patient. Provide labeled container for collecting urine. Explain about method for collection of specimen. Intra-procedural steps: take 2 ml of Benedict's solution in a controlled test tube A to check the purity of Benedict's solution. Take 5 ml of Benedict's solution in another test tube. Boil this solution in test tube B for 2 minutes. Observe the color and presence of any suspension in boiled Benedict solution and compare it with the 2 ml control test tube A. Add 8 drops of urine into the boiled solution of test tube B. Heat it again for some time and let it cool. Post-procedural steps. Observe changes in color and compare with standard color code for the results of sugar test in urine. If sugar is present, the results may be recorded among following. Blue liquid with no deposit means nil sugar. Green liquid without deposit means approximately 1% sugar. Green liquid with yellow deposit indicates approximately 2% sugar. Colorless liquid with orange deposit indicates approximately 3% sugar. And brick red indicates 5% or above. Next, test for acetone in urine. The definition is testing of urine specimen for detecting presence of acetone. The purpose is to detect the presence of acetone in urine. Steps of procedure. Pre-procedural steps. Explain the procedure to the patient. Provide labeled container for collecting urine. Intra-procedural steps. Put 1 cm of ammonium sulfate in a clean and dry test tube. Pour 5 ml of urine into it and shake it well till it is dissolved. Add 1 to 2 crystals of sodium nitroprusside and shake again. Pour 2 ml concentrated ammonia sulfate in a clean and dry from the side of the test tube to form a layer. If acetone is present, a purple ring develops at the junction. The depth of the color change and the speed with which it appears indicates the amount of acetone present. Post-procedural steps. Discard the urine in toilet and flush it. Clean the test tubes and other articles used for reuse. Replace the articles and discard the waste according to time of urine analysis. Wash hands. Document the results of urine analysis like color, smell, specific gravity, any presence of sugar, albumin, and acetone in urine. Document the date and biomedical waste management. Urine testing abnormal results are promptly reported to the clinician. Special consideration. For collection of urine sample in case of unconscious patient, catheterization is necessary. Thank you.